Good afternoon, everybody from here and at home as well. My name is Naesinee Chaiear. I'm from Khon University. My background is occupational medicine physician and also working as occupational health for health work in my hospital. I have so many slides, but I try to finish as soon as I can. Yeah, okay. My topic is trying to cover the whole Thailand about occupational health and safety for healthcare workers. And also, if I have time, I also like to talk a little bit about our hospital, okay? So, in Thailand, the approach of occupational health and safety is, the beginning is 20 years ago. They focus on the services, like a clinical service for health personnel. But actually, there's a big gap of not thinking of the management system. So really the approach, the beginning is the approach by the educators, interested like myself to start with. And later in 2000, before it's 2006, there's a regulation about occupational health and safety management for any kind of labors and also including healthcare work as well. But it's been ignored from many hospitals. And later days, in 2011, so they started the act called Occupational Safety and Health Act, which is actually it's taken it from the Labor Protection Act, and to start it with this act. So this act also look like not many healthcare concerns about the act, but major are the labor in the industry. In the same time, Division of Occupational and Environmental Disease, which belong to the Department of Disease Control, MOP, I would say Ministry of Public Health, I would say MOPH, right? And also starting to do some activity with healthcare workers, but actually their job is to do some surveillance and control of occupational diseases. And later days, I started to talk a lot with the healthcare accreditation, but not personally at that time or straight away. I actually did work with our hospital first and see when we wanted to carry on of this work, I think maybe we should go from which direction we should go. So the labor work, of course, would go from on the left-hand side, the legislation like a Labor Protection Act. But on the right-hand side, I used to go like along this way. It took me many, many years, I think almost 15 years. But if we work it for healthcare worker, I would go straight more and a shorter cut with working with the quality assurance, like this kind hospital accreditation. So this is a little bit clumsy, but this is, I think, only one I made it. And if you saw this diagram, must be crazy for me. Because I would try to describe what's really organization involved in occupational health and safety in Thailand and focus actually in healthcare worker. So if you see actually on the left-hand side, the Ministry of Labor, or in Singapore would be MOM, like other country in Asia country called Ministry of Manpower. But in Thailand, we still say Ministry of Labor. So when we say labor, people in healthcare worker or education would feel like, oh, we're not labor, but actually we actually labor, all right? That's our job. So Ministry of Labor have the act, and it's already said about medical institution must follow this act as well. Okay, but we forgot that. So Ministry of Public Health started to work on that and then put into the Department of Occupational Medicine Service. And then their work on the yellow line, they put on the unit called Occupational Health and Safety, but I don't think it's environmental actually. Put into the function actually adhere with the medical service. So they started to work on that. For the healthcare worker, Actually, HAI has started to be safety goal later in 2017. So at that 17, we made up simple for personnel. So the one that really include the big deal would go for process of work, the P. To me, is occupational health and safety management, and I was the person who really described of this P. Okay. Now, the law is changed last year, 2022. The big law of labor has started to mention that all the industry should follow the legislation called ministerial regulation. So that ministerial regulation has mentioned that health hospital or healthcare service must make the occupational safety and health management system, they said. So I would say called OHMS, right? Like management system. But many of people who work in this area in the hospital feel like they already done the job because they has the people on the number 5 on this one. Why there is not it's no laser? Okay. All right. In this area, they said, oh, already done this work, but to me, it's a kind of part of a medical service, not the management. In our country, my personal thought, people confuse between management and service. To me, now, I just discussed a little bit about that, but maybe there are some argument or question later we can discuss. So, it's difficult to bring people understand this, what I'm talking. It takes me 20 years, like I really familiar with that long journey. So, but I think the hospital accreditation institute has brought up the more shorter cut to get to the personal safety by putting to the quality assurance. And many hospitals really come across this institute rather than the labor law, right? Okay. So many slides. So in Thailand, there's big 2 types of hospital. It's under the MOP, MOPH, and under the university or some of a private hospital. This is an example of the university hospital like Khon University, Ramathipadi, or Chulalongkorn. There's 2 separate organizations to look after workers. For the workers themselves, like outside worker, industrial worker, there was a kind of occupational medicine service like clinic to do the services. On the big pink diagram, actually what I've written here, I try to integrate with the HA system, right, hospital accreditation, which is the part of occupational health safety has written into the section 1-5, which is human resources. So really, when I read the standard, occupational and safety management, taking healthcare worker, it's part of human resource work, not quite, but partly in the system of facility and utility management, or in Thailand, we call hospital environment. So, but there's some part that major part, it's what the HA 5.1 is. The major part is workforce and workplace. When we go to the human resources, people working in the human resource not really come across with workplace. They're focused on workforce, right? So when we talk about safety of the health worker, it's not only about health, really, the personal health, but also need to bring up the work-related health. But also we have to go and think of out of the boundary of the workforce, but also the workplace or even environment in the hospital and outside the hospital. So, oh, sorry about my English. I'm tired with English a little bit. Okay. For the management in occupational health and safety management in MOP hospital, they adhere to part of the service, right? But maybe they really bring up the committee separately under administration. It's under the medical service because that why the management of safety for health workers should be under the administrative team or even must be under the director, right? I think many countries has done the same of the system. Should be under and separately of anybody must go straight to or under cover by director of the hospital because they have to be free of their thought, a plan, and they should have the enough support for health workers. So the management of operational and safety for the public hospital now really adhere with the medical service from occupational medicine service. Right. So this is the journey why I met Dr. Piyawan, right? Long time ago when I look at my Facebook, wow, we already been with about 10 years more, right, to start together. People focuses at the before on patient safety and now move to personnel safety. But for personnel safety, with the HAI, I think they will make it easier for people to understand what about the activity or the plan or really the indicator to measure for human resource as well. So human resource management team should be part of operational and safety. I think you all agree. This is a kind of structures. This structure really is advice of the labor protection law, OSH law of Thailand. In any kind of industry, if there are employees more than 200, they should have a kind of office of occupational safety to take care of the workers. So I think many hospitals in Thailand have staff with more than 200. So this is the law. So, but the law now really need the healthcare services to be enforced as well. For hospital have employee from 100, they should have the certified safety officer to work with. And also, I think I like this structure too because what I did at in our hospital, it helps a lot for our administrative, like executive level, to understand health and safety of our people, right, to work. So there is a law that, like my dean, Ajahn Apichat, my director, hospital and professor Songsat, has to go to attend the 12 hours course to get executive level of safety officer, right, or this type of thing. And then all of the head of any wards or any wards, any OPD must attend this supervisor level 12 hours. But now I've done is 80% of our supervisors have passed and certified to be safety officer in the supervisor level. And once the supervisor and the administrator and executive understand about health, safety structures and plan, they will have the big support to drive to like a performance driven from human resource performance driven. I have 60 slides now, I'm 12 slides. So this is operational safety and health policy. All hospitals must have the policy. Not many hospitals in Thailand have separate office like occupational and safety office or occupational health clinic. But with my hospital 6,000, we need some kind of this specifically to do so. And my sales start from what I'm working one table, right? Initiative, they start with someone and somewhere, right? You have to have a virtual. When we call to work, what we shouldn't shout on, please help me to start this work. Once I'm the educator and I qualify as occupational health, I should start to work with somewhere and then become the big office to take care with safety officer, registered nurse, or even I train occupational physician as well. And this is part of the work to incorporate, to work well together.